Today's episode is a conversation with my dear old friend and co-resident, Dr. Abhay Dandekar. He's a pediatrician who spent the last several decades since residency moving through clinical hospital medicine, hospital teaching, program directorship, administrative leadership. He left his clinical job and went to a completely non-clinical administrative job. And then he came back to the exact same clinical home and back to the role that he had been previously, but he changed. And why I wanted to share this episode was the amazingness of the fact that he did not leave in crisis, and he ultimately did not land anywhere dramatically different or better than where he started. But he grew and changed and found solutions within himself. Today, we're going to talk about all or none thinking, about anchors and buoys, about the difference between mentors and sponsors, and appreciating diastole. And so for those of you who've ever felt restless, flat, not quite found in your career, stay on and enjoy our conversation. Thanks for joining us today at the Healing Medicine Podcast. Who are you listening to? I am Dr. Jessie Mahoney, and my co-host is Dr. Ni-Cheng Liang. We are two board-certified physicians who bring decades of experience to the conversation about wellness. If you crave more ease and aspire to rediscover your love for medicine and life, one mindful step at a time, you are in the right place. We hope you'll love today's episode, and if so, please share it. A reminder that nothing in our podcast is medical advice. So welcome to today's podcast, and I am here with my dear old friend, Dr. Abhay Dandekar. We were co-residents. He was the chief resident before me, as I remember, and I asked him to come on to have a conversation about his journey. And I haven't heard all the details of the journey. We're going to share them in a conversation live and as I learn and ask questions. But the invitation of the podcast for today is to really talk about finding your way and finding a way that's meaningful in medicine. And as I have watched Abhay's journey over, many, many years as we were residents together in the late 1990s.
A long time, yes.
Yeah. He has found his way doing lots of different super interesting things. And I have been inspired by seeing his journey, and I wanted to catch up and share it with all of you as just a possibility, what's possible. So, Abhay, thank you so much for joining me.
Pleasure's mine, by the way, and grateful to be talking with someone who's inspiring lots and lots of people. So, Jessie, congrats for it all, and so happy to be here.
I'm so glad. So, do you want to just introduce yourself and tell folks a little bit about who you are and what you do? And I would also throw into your introduction about your podcast, because it's also interesting and inspiring, and maybe folks will listen.
I think the idea, right, is just like good conversation. Yeah. You can't pass it up. And,
yes.
So as you are, I am first and foremost, the big part of our identities that collided, at least, and integrated and synchronized in whatever other ways we want to put it during residency, was that we have a love and a passion for medicine in pediatrics. So at my core, I'm a pediatrician. And from day one, that's been a great anchor for so much of what I do. And, over the years, the versions and the avatars of what being a pediatrician have looked like have changed naturally, right? I mean, we go from being in training to having confidence and developing trust in ourselves and the people and the teams around me. I found a lot of that kind of sanctuary in being in the hospital. And so probably the first, I'd say, 10 years of my career were really, really anchored at the hospital, doing a lot of hospital-based work. I was a hospitalist before they had the hospitalist term in a way. And just as that was emerging, found a lot of great, I think, joy and really a lot of energy in teaching and staying in that kind of academic medicine realm. So bounced around to a number of different teaching institutions, community hospitals, mobile hospital settings, universities, and, then came back to where I trained at Kaiser Permanente and in Oakland. And I think that first sort of, I'd say 10 years of that journey were really a lot of discovery, very, very common to what many people go through, which is, where am I finding my people? Where's my tribe? Where is the kind of fertilizer for the soil that I need to grow things, and can I actually grow things? And I think that, on the surface, it certainly seems like there are a lot of touch points, and yet they're all sort of additive, lots of connecting of the dots, and they all, I think, build upon each other with lots of iterative learning and great sort of pieces along the way. Spent another 10 years after that at Kaiser Permanente and TPMG in Oakland, and really just, continued that journey, and enjoying myself in the clinical space, in the teaching space, in the administrative space, in the community space. You find so many different things that bring you satisfaction. And more importantly, I mean, it's a reminder that no matter where you are, the roses and the trash smell the same. Right? It's just true, right? There, you could be at a big institution, you could be at a little tiny two-person practice, but a couple of things remain constants. Yeah. And I realized that no matter what my role was, no matter who the people were in front of me, who was in the room when I was chatting with them or caring for them or helping to lead or learn, there are some constants there. And I think that was actually really important for me to continue to recognize and sort of grow with. I did find and this sort of narrates up to the point where you and I last probably interfaced, where after all of that, right, you have these great moments in your career, you find different projects to work on, and the people that you're with are both coming and going. Patients remain constant. But I think at some point, I definitely realized that after all of that, there was this definite yearning and constant hunger for either newness or more learnings or engagement in ways that at a particular point, I was not necessarily feeling so much of. I don't think I ever felt lost, but I also never felt found at the same time, right? So in a way, I kind of was thinking about this and reflecting on this in sort of advance of even our conversation just now, is that point when you and I were talking, when both you and I sort of left clinical medicine almost around the same time. I probably was at a space where there was definitely a lot of hunger for something new. There was definitely a lot of yearning to understand and see, okay, am I really maximizing my full potential? Do I see myself with someone as someone who has agency? Do I have the autonomy to kind of search for that? And I think that where I was at, naturally, like people do, you go through these like stagnancy plateaus. Sometimes they last a day, sometimes they last a year, sometimes they last longer than that. Hopefully not that long, but I found myself thinking, okay, do I want to actually, instead of staying on this sort of treadmill, do I need to go to either another treadmill or do I need to step off the treadmill for a little bit? And I chose to actually go into kind of the administrative medicine space for a few years. And I think more so, again, because really wasn't that complex. The soil around me wasn't getting watered. I didn't feel I was having that sort of sense of sponsorship and that sense of community where I was at that point in my career. I saw a terrific opportunity to jump into that administrative space. And actually, this was, I think we were just trying to figure out what time frame it was. It was a couple of months before the pandemic started.
Yes, I think so.
Yeah. And we've learned so much during the pandemic era of what we need, how we actually help each other, how we support each other, and actually the anatomy of what physician resilience and burnout really look like, right? Yeah. So my thinking at that point, this is all pre-pandemic. And, really not at a stage where we had gone through any of that yet. So I actually left that stage of clinical medicine, I think my last day was 5 days before the lockdown. And, prescient in a way, right? Like I had no idea that the entire world was going to change.
My last day was 15 days before
15 days. Okay. See, look at that. Boy, we really had a mirror image of each other.
Yeah. Yeah.
And I mean, I don't know how you felt, but, as soon as those two things happened, I had left clinical medicine, and then the lockdown happened. Really, there was this sense of both kind of wonder and fear and relief at the same time, right? That like, wow, look at this. If things are changing so rapidly, and yet there's a big precipice of the unknown. And my personal nature is a little bit more on the optimistic side. So I was pretty excited by that unknown.
Yeah.
And, in the sequence of things, actually enjoyed doing administrative medicine. It was sort of like getting a healthcare MBA on the fly,
on the job,
and on the job, right? And really, really learning about systems and the healthcare movement over the last 50 years and how that's played out. And for that matter, of course, how to navigate through that system within a pandemic. I also found that, again, that sort of mantra of the trash and the roses being the same no matter where you are was very, very true, whether you were in clinical medicine or administrative medicine or, any other kind of avenue or pathway. So, you quickly realize that many times, no matter where you are, it's still the people, it's still the functionality, it's still how do you actually surround yourselves and with great colleagues and mentors and learners, and are you all kind of part of a mission together? Do you have that kind of autonomy and mastery and purpose and all the things that we, I think, link ourselves to avoiding things like burnout? Turns out for me, I found all those things and enjoyed the work, but I did have some personal things that actually were complicating things in a way. My wife was diagnosed with cancer. My kids were in high school and they were going through the pandemic. And, at the same time in administrative medicine, the pandemic was certainly affecting that aspect of things too, where people were finding themselves, okay, I'm doing the work of 5 different people, and there's lots of heavy turnover. And so eventually, after those few years in that kind of non-clinical space, one of the benefits, I thankfully never fully left clinical medicine. So I still was doing some spots of urgent care and seeing patients and teaching and kind of keeping my toes dipped into the water, as they say. But I did come to sort of another plateau of saying, I really do find home when it comes to clinical medicine. I really do appreciate that having had that administrative medicine experience, it actually made the clinical experience feel that much richer. And I found that, I could actually still blend all of that together. It doesn't have to be a binary option, right? Where you have to say like, look, I have to leave or not. And you can find ways to actually make those things harmonize. All the things that you really like about learning and growth and opportunity and that hunger for something new, along with the things that actually are keeping you, stable. I don't know why this took on some sort of nautical theme, but I always think of anchors and buoys, right? Yeah, there's anchors that like really keep us, set and stable, and they're really like, allowing us to dock, so to speak. But then there are the buoys that sort of like, they're there to navigate us. They're there to help, keep us afloat. And when you find both of those together, it actually does feel very, very fulfilling and magical. And so I went back to clinical medicine, in fact, right back to Kaiser Permanente and TPMG, 2 years, almost 2 years to the day after I had left, and didn't miss a beat. And really, I think the lesson from all of that was I actually, when I came back, I, for one, stopped feeling like a futurist. And what I mean by that is that I wasn't constantly thinking of the hunger or the yearn for the newness of something. Wasn't constantly feeling like hey, I have to find agency or find sponsorship or find mentorship. And in fact, a lot of that stuff is all around us. We can find agency in little things. We can actually find a lot of grounding in what's in front of us. And being engaged with both patients and people and colleagues and the entire ecosystem of what we do in clinical medicine, and particularly pediatrics. I do think that pediatrics is a big, big reason why this was relatively less complicated for me. Because at the end of the day, those office visits are really what I think were sparking a lot of restorative fulfillment in my case, at least. And everyone's story is a little bit different. But that for me, it was so grounding and anchoring. And since then, I have continued to take on a lot of other roles and practice some administrative medicine and practice some teaching and practice clinical medicine and surround myself with colleagues. And I would say that at this stage in my career, much like when we were residents and much like throughout the other touch points of my career, when you have an environment that sort of feels like a family room, where you have people that you are really in love with, and at the same time, they can frustrate you and they can make things wonderfully joyful, and they also get complicated, and that's what being in a family room is all about. And thankfully, I've certainly not only just found that, but as I mentioned earlier, think this was not a kind of journey of feeling lost and having to discover things. It's more that I wasn't feeling like I was found, and I feel a lot more found these days.
Yeah, and not so much found by other people. You sort of found by yourself, right? The inner self or the inner connection.
That's right. Yeah. And that's a good way to put that. And thanks for actually pointing that out. It doesn't always mean that it's found by other people. You do need people to cultivate relationships and make sure that you have, that sense of agency, because we don't, work as companies of one all the time.
Especially in medicine.
Especially in medicine, right? It's totally a team sport. And making it well kind of aware to yourself and reminding yourself that agency coming from within. And again, it's okay to devote time and energy and effort to that finding, to that discovery. And it does really need to get initiated and sparked from within.
Yeah. Well, and it's interesting because you mentioned when you were first looking for it. And I think this is I see this paradigm in folks all the time. And I think even in myself, that we have this sort of all or none, right? You're staying or you're going. And it's really this, and that it's better somewhere else than wherever you are, or you're missing something, right? Our doctor brain is trained to think all those things, right? There's a right place and a wrong place, and they're right or wrong, and I'm right or wrong, and I fit or I don't fit. And then this sort of idea that it's not actually that. It's like this sort of multicolored tapestry, and that once,
a lot of grays.
Yeah. Once we can kind of see that, then the choices become much more interesting, right? And it's interesting because when I left, I had told myself the story that one couldn't go back. You made your choice, which wasn't, and I'm actually very happy with where I am. But, and part of, but that story was actually something I held on to for a long time. So when you went back, actually, I was like, I'm not actually and I knew that I could go back, right? I had been there for such a long time. I was somebody who could have jumped right back in where I was, right?
Right.
But so to actually see that belief that I had cultivated, which was it was just part of the belief that sort of helped me build what I was building. So it was a helpful belief. But it was also really helpful to let it go. And then, so when you went back, I was like, oh no, I'm still choosing this path. And I just think it's interesting. And I'm sure you don't even know that, but I literally had that story. And then I watched you and I was like, how can that be? It just was this moment in my mind of, and again, it's like this all or none, because I had actually been asked to come back multiple times. Like my chief was like, are you sure you don't want to come back? Because we really need some help post-COVID. There's all this stuff we really needed. We were trying to catch up on child checks. They needed all these things, right? And so I just think it's fascinating that our brain sort of has these stories of like, I need to grow and I can only grow here. But what
that's, by the way, it's very true that we like routine. We like boundaries. I mean, some of us do. I can't say everyone, but a lot of us will say that like, hey, well, if I'm moving forward, then, quote unquote, going back is not necessarily in a forward direction. And that for me was not the case. There's a lot of, I've kind of seen some parallels with some professional athletes where, especially in some of those contact sports, they retire, but they still feel like they have, up here, they're like still playing, right?
Yes, yeah.
And when they are asked to go back or they're asked to consider going back, a lot of times they're like, yeah, I still have that drive. You ask professional, contact sport athletes, football players in particular, and they're like, look, after that first or second day of practice, after that first or second day of getting hit 100 times, they're like, look, I don't think I want that. And, I do think that sometimes we do have short-term memories of the things that cost us, right? The things that actually do take the hits on a day-to-day basis. And the question is that like, when you're actually revisiting that or refreshing that or restoring that as part of your professional practice, do they take the same kind of hits on you? And do you allow for that to happen? Have you learned from how to make that happen or how not to make that happen? And for some, the choice is obvious that, it is quite black and white, and it does feel like it's going backwards. And for others like me, it definitely meant that, I can do this in a very different way. It means something different to me. And for me personally, it was really, really being very proud of and, happy is sort of like a weird word, but really just positive about the day-to-day. And I didn't necessarily see some of those day-to-day hits as being, the same as they were, say 10 years ago or 20 years ago. Because you're right, at different points in our careers, they do mean something different for us.
And you went back from the outside as sort of a different person. Like some people take a sabbatical. True. It's almost like you took a 2-year sabbatical in administration during COVID, which is not exactly a sabbatical, but
right, yeah.
And then, but it changed you, right? And what I thought was so cool about your journey is that we don't see that many people go, and I'm going to use the word go back, but back to the place that they were and have the place that they were be the solution. And it shows the power of when we change the way we're approaching it. Like the place that you were became this beautiful place again. And honestly, when I knew you, it was a beautiful place for you. So it was like you shifted and changed, and maybe you stepped off and stepped back on but you did some changing on the side. And I often tell people, I actually coach a lot of physicians at Kaiser, and I say, like, most people who work at TPMG and Kaiser, like once they pause and really look at how they're approaching things, it's actually a pretty good place to be. And when you change how you show up for it yourself, whether you lean into your own agency and autonomy, and I heard you mention sort of some things like non-judgment and presence and shifting your attention to certain things rather than other things, that many people end up loving it again because it was really just, they sort of got distracted by the pulls and the noise of medicine. And boy, by the way, there are lots of noise of medicine right now, right?
Oh, yeah. Yeah. I think that's a great way to put it, in that thankfully in my situation, and again, everyone's situation is very, very different and unique. But in my situation, thankfully, I didn't leave out of duress.
Yeah.
I didn't leave because there was a toxicity to things. I didn't leave because I was actually, unhappy with clinical medicine. And I found that, again, seeking, different places of excitement was pulling me and motivating a lot more than the current place of excitement. When I went back, it was actually really telling that when I did go back, I found the same layers of family and sanctuary and home and community and all those things that, make you feel wanted were still there and still certainly exciting. But I was actually like, I had certainly opened both my eye and my mind and my heart to just seeing that, on a day-to-day basis. Right. And again, just trying not to necessarily be a futurist. And that was actually really, really important, because I do think that wherever it is that you're growing, right, you need solace, you need sanctuary, you need excitement, you need some sort of livelihood. And that actually, I think on a day-to-day basis, when you can find that either in yourself or you have people around you that actually remind you of those things constantly, it allows for you to then be vulnerable and kind of be yourself and, let things actually develop and cultivate without being so fixed on like, well, okay, what does this mean for tomorrow? And that's actually, for me at least, that was actually super important. And I was so jazzed about that when I had gone back to, again, and seeing familiar faces doesn't hurt either, right? You do become that much more reminded of like, why you do call a place home.
Yeah. Well, and what I hear in your story, which is really cool, is that you completely have your own back about your decision to allow yourself to grow and your decision to go back to Kaiser TPMG, and like it all happened the way it was supposed to. We hear so often this like judgment of, well, even when you first leave, I made a mistake. I shouldn't have been doing medicine. And then this didn't work out, so I made another mistake. And instead it's like, oh, well, I was learning and growing. And you just came back and you've actually, from the outside, continued to learn and grow in a bunch of different, really interesting new roles. And I think just the notion for other people to see who are struggling, like we can all get to this point, and I think it's pretty common. It's common humanity that we get to a point where we're like, wow, this is all there is. Here I am. How do I grow? Who do I want to be? This sort of crisis, and there are lots of solutions to it. And for some of, the journey looks different for everybody.
Yeah, Jessie, we test and we try, and we have a really good way to organize that from a clinical standpoint, right?
Yeah.
Hey, I saw a patient, I tried this, but there was some nuance about it that didn't work. Okay. Yeah. So fine. In our professional lives, do we have the courage and the vulnerability to say, I need to, either there's protected space for that, to test and try and dabble. And if we get better and develop more confidence, then maybe that dabble turns into something that we really, really enjoy doing. Now, for some, that's academics and teaching. For others, that's administrative medicine. For others, that's community development. For even others, it has, they're great, sort of venues to place that energy completely away from clinical medicine, their profession. Some version of that is important, at least it was for me, to make sure that my battery is always on. And whether that's stepping away and saying, hey, I was very interested in developing a podcast and sharing conversations about the global Indian and South Asian community. I wanted to do that. That was something I was kind of dabbling in. And now that's something I really enjoy doing quite a bit. It's probably no different than saying I'm going to pick up golf, right? Right. But I having that outlet, having that venue, and then within the professional space, I'd really like to get better at leading people, or I'd really like to get better at some kind of clinical domain, or I'd really like to get better at how do I communicate with people and solve, kind of problems of the day in healthcare or clinical medicine, or for that matter, none of those. I just want to get better at sort of managing my practice. And being, all that I can when it comes to, children and families every day. So any one of those, I think, problem statements, we either have the license and the courage to say, I'm going to kind of test and try. Or, if we're not at that space, then sometimes we either need the nudges from others to help us do so, or we need to develop gradually the confidence to be able to go in. And I think that there are really good examples of that all around us. And hopefully it just means people tap into that more.
Yeah. Well, and I think just hearing other people's stories and having the conversations to see that it's possible.
Very true.
One last thing I just want to add, and then I'm hoping you'll share some final words that for people who are struggling, who are in that growth spot, like that they're frustrated, any thoughts for them. But one other thing I notice in your story, and I see this a lot, is that we, especially when we've been in an organization for as long as both you and I had, that we expect the organization to solve this growth problem, right? That they should be solving it for us. And yet I think for both of us, what we discovered is it's actually like we want them to find us, to see us, to solve this, right? And yet where the solution comes is us finding ourselves and looking for it ourselves, and the test and the courage. And I see very often that in the sort of way we're trained to think in medicine, we always think that it's someone else, like, well, here I am, Kaiser should make it interesting, or Sutter should make it interesting, or
right.
Team
Stanford
Health or whatever. Yeah. It doesn't matter. That's sort of the way we're trained to think. And so what I see in people who found their way, and whether their way is back to where they started or somewhere different, it's really the courage to take it on yourself, to give yourself permission to do it, and to explore, and maybe even to have it not turn out the way you thought. Like you can make a step and not call it a misstep. It's just a side step, or it was really yours. In your case, it was a forward step, just a little bit diagonal, and then another forward step back, right? But still forward.
Yeah, I love the way you put that. I mean, you're right. If one thing that I have, I think, come to appreciate is when you live and grow up in an institution, no matter where that is, right? You expect that because you have, given so much of yourself loyally to that institution, to that group, and, you feel that like, well, okay, I deserve more. Like I deserve to be seen. I
just want to say you do. And right, like both you and I gave years and years and years and nights and weekends and all the things. And right, there's that other piece that it's not really their job.
Right. And so I think what I was getting at was, you're right. It's not necessarily their job. It's not necessarily the role of the institution to, say directly be sponsoring each and every one, when in a way they actually are doing that. Right.
Yes. Fair.
And yet, I think what you said is actually very important to, reiterate that kind of sponsorship, that agency, that ability to actually seek it out yourself is just as much a part of that partnership, right? Yeah. So sometimes that partnership includes advocacy for yourself, finding the sponsorship, understanding where it might actually live within the institution. Yeah. And for others, or sometimes you try that and that may not exist in the institution you're in. It's okay to actually say, hey, look, I need to find out where that grass is going to be watered better, not just green, but where it's actually going to get watered better. So in that way, I think you're right that first thrust, that understanding, that kind of mirror that you hold up to yourself, it has to start with you. Yeah. And that's a really, really important call out, because your institution, while it may be a wonderful institution and really filled with wonderful people, the bigger the institutions are, it's just harder actually sometimes for the same thing that you're seeing in the mirror to be seen by everyone else.
Yeah, well, and you added another point, which is that very often the sponsorship and the support is there.
Yeah.
But that you can't see it unless it's coming from you. And so that, you might, once it comes from you, you might find it there, you might find it somewhere else, but who knows, right? It's complicated, but without it coming from you, you feel stuck.
Yeah. And that's the difference sometimes in having mentors and advisors and sponsors, right? I mean, your mentors, your advisors, they're wonderful at support. They're wonderful at, providing advice and giving you sage counsel. Your sponsors are really the ones who are accelerating your cause and, really understanding your purpose and seeking how to advocate you when you're not around. Yeah. And that's actually equally important in a larger institution. Even if you're not in a large institution, you're in a smaller group, you're in some sort of unique professional practice, you still need sponsors. And those sponsors can be found in areas, but those are relationships to cultivate over time.
Yeah. And the importance of paying attention to cultivate them. Like many of us think they should land in our lap, right? And they don't. So do you have any final words just for our listeners, recommendations for those feeling ready to grow?
Right. Well, I do think that it's important to keep thinking out loud and really finding thought partners, because those thought partners could be, we make assumptions by the fronts that we put up on ourselves and the fronts that are on other people. That, hey, look at this person. They've been here for 35 years. They haven't had a single day of struggle in their life. When in fact, they may have gone through the exact same thing you just did, maybe 10 years ago. And to others who are like, hey, this person seems like they're a shapeshifter. They seem like they're constantly reinventing themselves every 2 years. You don't know the backstory behind that. And so, especially for people who you trust, find those thought partners so you could have a variety of different conversations and stay away necessarily from the echo chambers that are just convincing you of kind of going down a pathway that may not necessarily be the one that is filled with growth. It doesn't have to be the right or the wrong pathway, but I think if you're finding growth opportunities, those are the ones that tend to be, in the long run, in my opinion at least, much, much more likely to provide richness and stability and real sort of joy when it comes to how you can actually have longevity in your professional career. So that's one thing for sure, have conversations, find thought partners. And the other is, constant self-reflection. It's so much more powerful to listen to yourself and journal and provide thoughts and hold up that mirror than it is to try and necessarily always do something. So I think that there's equally, yes, we need executive function and we sometimes need to act when you act. And also just pausing and reflecting. And you and I have talked about this, right? Appreciating diastole. Put that a part of your everyday practice.
Yeah, I love that. Thank you so much for having this conversation. It was so fun to see you and reconnect. And I am certain that your story is going to resonate and give someone hope and optimism and a path forward and a way to explore. So I am ever grateful. And this was terrific. Yeah.
I was just going to say, it's so terrific, Jessie. Really appreciate and love what you do. And thank you for always inspiring so many people and having that sort of voice and that ear for them to rely upon.
Thanks.
Thanks for listening. If our message resonates, we'd love to connect further. Join us for coaching, mindfulness experiences, workshops, and retreats. Invite us to speak at your institution or conference. When you work with us, you don't just consume information, you create real change. Find Mi Chang Liang at Awakened Breath and Jessie Mahoney at Pause and Presence.
Welcome to today's mindful moment, a practice in curiosity, non-judgment, and openness. Closing your eyes and coming back to your breath if it's safe to do so. And bringing a hand to heart if it's safe to do so. Sending yourself compassion for your journey, whatever it's looked like, with forward movement, sideways movements, diagonal movements, taking in a deep breath and an exhale. Wrapping your heart with the breath, with the next inhale, and a long, smooth exhale. Pressing your hand into your heart space, releasing some oxytocin with the next breath. And Notice in this moment now if you feel like you have some more space to think and breathe and notice. And I invite you to ponder this idea of not feeling found. And whether you've thought others should be there to help you find yourself, whether your organization should make you feel found, or somebody else needs to see you and find you, or maybe the journey is to find yourself. What would it feel like to feel found, to find yourself, to reconnect to yourself? Breathing in once again, feeling the breath on the palmar surface of the hands as the chest rises and falls. Another long inhale and exhale. And it may be that this not feeling found or seen is in your home life, your work life, certain parts of your career. Maybe it's just a gift you've never given yourself. And I invite you to think about here, what might it take for you to begin to feel found? Might help, solutions, conversations, support help you? Might a community help you? Might it be a shift or a change? Maybe it's external, maybe it's internal. But if there was not better than here, what might you start with, consider, think about? And maybe it's no action that needs to be had. So taking a moment with kindness and non-judgment, just to notice where you are and what might it feel like to be found, to find yourself. How might you feel differently if you were found? What might you do next if you had been found? And just letting those thoughts percolate in, no pressure to find an answer, no decisions needing to be made, in this moment of quiet and pause and peacefulness, with a more regulated nervous system and space to breathe, what insight do you have? When you're ready, just slowly open your eyes and come back into your body, coming back into the space that you're in. Thank you all so much for practicing with me. Have an amazing week.